We did our PowerPoint on stroke. Stroke is a common medical condition caused by abnormal brain blood vessels where parts of the brain either become damaged or die. It occurs due to either a blood vessel in the brain bursting or when part of the blood supply to the brain is blocked. Lasting brain damage or even death typically results from a serious stroke.
There's three types of stroke. The first one's an ischemic stroke, which is the most common one. This occurs when there is a blockage of blood vessels to the brain, leading to reduced blood flow and oxygen to the brain. This is like a type of clot. The second is a hemorrhagic stroke, which occurs when blood vessels burst and bleeds into surrounding tissues, which compresses the brain and leads to cell death. And the third is transient ischemic attack, which is a mini stroke. This occurs when blood flow to part of the brain is temporarily blocked. This type of stroke is only lasts for a few minutes. This is sometimes called a mini stroke and can lead to, it could be an early sign of a major stroke.
So the two main strokes for the ischemic and hemorrhagic. For the ischemic, the risk factors are blood clots in the brain and debris carried by blood. So it could be fat as well or plaque. For hemorrhagic, it is uncontrolled blood pressure. It could be a result of blood thinners or anticoagulants and aneurysms. Some of the common causes: obesity, poor diet, lack of physical activity, smoking, alcohol consumption, high cholesterol, etc., or just overall unhealthy living.
So the effects of stroke can vary. It presents differently depending on the location and the severity. As you can see on the left side of the brain, if it's affected by the stroke, you can see speech problems, maybe trouble swallowing, right-sided weakness or paralysis. While on the other side of the right side of the brain, you can see vision deficits, maybe blindness or cloudy vision, left-sided weakness or paralysis. Um, Behavior-wise, it's interesting how different the left and the right are. The right side, you can see more impulsive behavior, while on the left side, it's more of a slow and pensive behavior. Generally, there are some effects that can happen regardless of which side. Changes to personality and emotions. A person can feel depressed, anxiety, mood swings, emotional outbursts. They can experience memory loss, difficulty problem solving, and urinary or bowel incontinence.
There are multiple different ways to prevent a stroke. So one would be to lower your blood pressure, especially if it's already high. Eating a healthy diet that's pretty low in fat. Losing weight if you have any weight to lose, and then limiting alcohol content and quitting and avoiding smoking if you do smoke, as this can lead to a greater increase in clogged arteries and vessels, which would put you at higher risk of developing a stroke.
So for stroke recognition, the common acronym used is FAST. So acting fast, when looking to see if somebody had a stroke, you look at a couple of different things. So first is the F for facial drooping. So unilateral facial drooping also comes with slurred speech, unrecognizable speech patterns. And the A is for arm weakness. So again, unilateral arm weakness. Typically you have them raise both arms. One side will droop while the other one continues to go up. So S is the speech is the slurred that, or excuse me, speeches that is slurred or hard to understand, kind of like how I just was. So kind of unrecognizable speech patterns. And then the T is for the time to call 911 if these symptoms are present.
So for treatment for ischemic, the most common treatment is Alteplase, which is an IV medication, and it can dissolve the clot, but it works best if it's given within 3 hours. And then the second option would be a thrombectomy, which is when a stent is placed through the clot and then it's expanded and then pulled away from the walls of the vein, and then it is suctioned out. And then that should be done within 6 hours of the stroke. And it's really important to receive treatment as soon as possible because the longer you wait, the worse the effects will be, and it can also cause death. And then for hemorrhagic, you can get surgery done to stop the bleeding at the base of the blood vessel, or a catheter can be placed through the artery, and a tool would be placed to stop the rupture.
So for the rehabilitation for the stroke, doctors recommend the most rigorous plan of care and therapy to be handled for the best results. Treatment includes a variety of specialists such as neurologists, PTs, OTs, STs, dietitians, psychologists, and social workers. Many of the fundamental therapies that cover the needs of stroke survivors include motor skills, strength and coordination, cognitive skills, speech, vision, balance, and adapting. And you also have to consider which side of the brain the stroke happened because it affects different movement and sensation of the body.